Silenced suffering, the persistent practice of female genital mutilation in Africa. Female genital mutilation, FGM, also known as female circumcision or female genital cutting, remains a prevalent issue primarily in Africa, although it also occurs in some other parts of the world. FGM refers to the partial or total removal of external female genitalia or other injury to the female genital organs for non-medical reasons. Despite efforts to eradicate the practice, it continues to affect millions of girls and women, posing serious health risks and violating their basic human rights. The procedure has no health benefit but can cause serious health complications and can even lead to death. It causes extreme pain and has severe health consequences, including difficulties during childbirth. Girls are cut in unsanitary condition with unsterilized equipment and without anesthesia. Female genital mutilation is cutting and removal of parts of the female genitalia. In some communities, girls between the ages of 2 to 15 years undergo through female genital mutilation. Girls and women who underwent through female genital mutilation can experience severe menstrual pain and infections, intense pain during sexual intercourse. The complications associated with female genital mutilation can stay with a woman throughout her life. Teenagers are blindfolded with their legs tied and their chest pressed by women. One razor blade is used to cut many girls. They make girls believe that female genital mutilation will make them be clean, be accepted within the community. They tie them with a rope from waist to toes. According to girls who underwent through female genital mutilation, urinating is very painful because of the wound. After the female genital mutilation is performed, mixture of ground charcoal and donkey feces are sprinkled on the wound. Even with excessive bleeding, going to hospital is not an option. Women lose their babies during labor due to a constricted birth canal. They go under cesarean section for childbirth. Some babies don't survive due to the delay of report the hospital. Some of them also give birth to children with disabilities. Female circumcision is widely practiced in the northern part of Ethiopia, specifically in AFR region. First, they tie the girl to a tree and she would sit at the center of many elderly women. Then we dig a hole where she is. After stretching her legs apart to the side, they cut the clitoris with a razor. The hole serves as a place to get rid of her blood and for the piece we cut off. Then they untied and carried her to the house. During the 3rd week, they check that it has been stitched well enough. If there is a gap, they pierce the nearest part with a torn. Because if the hole is too big, it would be considered taboo. Before a woman in the community gets married, an elder woman checks if she has been circumcised correctly or not. If the girl resists, the other women would force her to show it. Afterward, if her husband finds out that she has a gap, she would be in shame. And he would go to her relatives and say he found her open. On contrary, if the man finds out that the woman is a virgin, they would slaughter a cow. Eliminating female genital mutilation requires a multifaceted approach that addresses its root causes, including gender inequality, poverty, and lack of education. Efforts must focus on empowering communities to abandon the practice through education, dialogue, and alternative rites of passage. Healthcare providers also play a crucial role in providing medical care and support to survivors. Ultimately, ending female genital mutilation is essential for ensuring the health, dignity, and rights of girls and women in Africa and beyond. Please subscribe to our channel for further cultural odysseys from across the globe. Until we meet again, stay curious, stay explorative, and may the spirit of adventure guide your path.